which means Just Kidz Emergency is in studio with us. And today we're talking about managing choking in infants. Joining us is Dr. Paula Robertson, no stranger to the show, a consultant in pediatric emergency, and I would say a lot more. Good morning, Dr. Robertson, and welcome.
Morning. Thank you for having me.
It's a pleasure to have you with us on the show this morning. And I see also, can you remind me of her name?
Officially, it's Resusci Annie, but we call her Annie for short.
Okay, and this is Annie's second time on the show.
It is,
as well. And of course, we see with this, we're going to be having some demonstrations this morning. But let's get into immediately the difference between choking and gagging.
Yes, and this is a big question that comes up because the biggest time I get questions about this is when parents are weaning infants for the first time. Mm-hmm. And a big fear is often when they notice the little one is starting to maybe retch or gag on foods. And it really frightens parents to the point where sometimes they'll actually back off introducing solids, which is an important part of children's development. So we normally start by saying, actually, the thing is, when kids are learning to navigate solids for the first time, it's quite a complex skill. They've got to learn how to move food from the tip of the tongue all the way safely back to the back of the throat, right? Mm-hmm. Without it going down the wrong way. So it's common to get maybe a little bit of gagging when they first introduce it. Yeah. So there is a difference. So gagging isn't choking. And the difference I usually tell parents is if they are loud and red, right? So they're red, they're coughing, it's definitely audible, then it means that they're probably more likely to be gagging. You want to watch them closely, but you don't need to necessarily intervene in the way that we'll talk about later on.
All right.
True choking is usually quiet or silent. So silent, blue, or if they look like they're in a lot of distress and difficulty breathing, then yes, that's when they need you. Loud and red, let them go ahead. Encourage them to cough by rubbing their back gently, maybe letting them know that you're there.
Yes.
But silent and blue, that's when they need you. That's an emergency.
My goodness. Okay, so the next thing that comes to mind, of course, talking about choking, gagging, is toys, because we all have toys for our children. So we need some tips for home safety.
Yeah, no, I'd say that's a really good question. Practically, the main things we often have to think about are when you're assessing toys for kids, look at their developmental age. So that's both the age that they are, but if kids, for instance, are neurodiverse and have sensory issues, you want to make sure that the toys are appropriate for them. There are no small parts for younger kids. There are no detachable parts. I remember before Christmas, we also spoke about parts like batteries and so on that can be easily be removed. And so you really want to make sure that they're okay. So they're age appropriate, they haven't got little parts that can be removed easily, and that they are, if you've got older kids, that their toys are packed away safely at the end of playtime. And the other common issue is, again, around food. So you want to think about appropriate foodstuffs. So my main rules are no hard nuts or candies in infants. You're much safer introducing things like nut butters instead, because those are softer. And you want to also be careful with things like grapes, channet seeds, for instance. So the American Academy of Pediatrics actually recommends cutting grapes in quarters or halves until they are at least 6 years old.
Until they're at least 6 years old?
Yeah, because that's the nature of the grape is that's easily compressible. So if they have, especially the green seedless grapes, they can easily get down airways.
Goodness, all right. So if we are in this situation, we need to speak about the first aid approach and what we need to do, essentially.
And that's where Annie comes in. So really, there are three questions you need to ask yourself. First of all, the first question is, are they coughing? Right? So if they're coughing, just as we spoke about, if they're loud and red, you can hear them and they're coughing, they seem to be they're able to actually cough effectively. So if that cough is effective, you really just want to encourage that cough by the methods we talk about. So rubbing the back gently, letting them know that you're here. Always feed infants supervised, fully supervised, and always upright when they're introducing solids. So those are two other tips as well. So check to see that cough is effective. So step one, if the cough is effective, they're loud and red, encourage the cough.
Okay.
Step two, if the cough is quiet, if it's silent, they're silent and blue, and that's when we need to move into our first step of first aid, which is applying some back blows. Now, there's a couple of things to know about babies. One is that they tend to have relatively large heads and short necks, and they can be a little bit floppy. So the first maneuver is really to support the head and neck, and usually what I do is I take 2 fingers just on the cheeks, just to keep that supported. The second is you can brace their body on your forearm, And then either on the thigh or your forearm, have them so that the head is pointed downwards below the level of the chest. And the next step is we're going to use the heel of our hand and aim for between the shoulder blades. And deliver 5 firm back blows, like so. 1, 2, 3, 4, 5. I know. When you've done that, you want to turn them over and see if you can see either the object has flown out or it's easily visible. Only if it's easily visible do you use your little finger to get it out. Never do a blind sweep. Never actually push your finger in, because sometimes what happens if you don't see an object, because what happens is you might actually inadvertently push it down.
Oh my goodness.
I know, right? So I don't know if you want to demo doing those back blows. Are you feeling it?
I would like to, but I don't think we have enough time during this segment because we have so much to talk about here. So my next question is, what if the obstruction isn't relieved?
Sure. So if at this point, well, 2 things may happen. We may find that the obstruction is relieved, in which case, and their baby starts breathing again or maybe crying, in which case what you want to do is to turn them on the side, what's called the recovery position. Let's see if I've got them in your camera. Really, that usually by convention means the left side, brace them with the leg bent on top and the hand just under the cheeks. All right. If, however, they're not breathing, or that they're not that they're not breathing, if the obstruction hasn't been relieved, we're now going to move to chest thrusts. So by this time, we flip the baby over. You want to support the back of the head. Again, have them so that the head is lower than the chest. Brace them on your thigh. And the landmark here is 1 finger breadth below the nipple line. And you're going to use your 2 fingers, basically, to deliver 5 firm chest thrusts. So 1, 2, 3, 4, 5. Okay. And again, you want to have a look, remove any obstruction if you can see that. And if your obstruction is relieved, you go right back to the back blows and repeat until your obstruction is removed, or if help has arrived. So one of the other things is to call for help early. Yeah. So that's the second measure. Right? Now, if at any point your baby becomes unconscious, or you feel that they're not breathing, we need to go into CPR. So third exercise is really CPR. And this is where most people get a little nervous.
Of course,
But again, a lot of our landmarks are the same. So for this purpose, what we normally say is get your baby onto a flat surface. The first thing you want to do is to have what's called a safe approach. Shout for help, make sure baby's safe. And as in there's no hard objects or hard surfaces that may injure baby. You want to assess the situation and open up the airway. So the easiest way to do this in babies is to get the head into what's called a neutral position, so that a line drawn from the nose is parallel with the rest of the body. So I'm just going to do that and have a little look and see if I can see anything in there that needs to be removed, and do what's called look, listen, and feel. We bring our face down, have a quick look down the chest to see if the,
I'm just going to move this cup here.
Just to see if the chest is moving at all and if we can feel any breath against our cheeks. And we do that for about 10 seconds. If that's not happening, then we need to deliver some rescue breaths. So I'm actually going to demonstrate that. With babies, what's good is that we can actually seal the mouth and nose at the same time by putting our lips over that. And this is our baby, so we can do that. So what I'm going to do is to actually put my mouth over that and deliver 5 breaths so that the chest moves, like so. So I have 5 good chest rises there. Next, I just need to see if there is a pulse. So again, because babies have short, fat necks, best place to feel it is just inside the arm, just above the elbow. Or in the groin. There are 2 pulses there as well. So I'm just going to feel that. It's just to see if I have a pulse again for about 10 seconds. And if there's no pulse, baby's not moving, there's no signs of life, I need to move into cardiac compressions. And that is the same landmarks as we use for the chest thrust. 1 finger breath below a line in the nipples. I'm going to go about 1/3 of the depth of the chest, and we deliver a rate of about 100 to 120 per minute. But I'm going to give 15 compressions to the rhythm of staying alive. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
And I just sang Staying Alive in my head.
In your head, right? Yeah, it's really catchy. At that point, I'm going to give 2 rescue breaths again. And I continue like that, 15 compressions to 2 breaths.
Wow, fantastic.
We do that for a minute or until help has arrived. So really important that you call for help early. And if help hasn't arrived, pick your baby up, keep doing your chest compressions while you get assistance.
Thank you so much for sharing this. And we are very close to the end of our conversation. But before we get to that, we did speak about the fact that you are having a first aid.
We are, yeah. So this was a little taste of what we're going to be teaching parents in our first aid course. It's coming up at Just Kidz on the 24th of February. So give us a call in 612 Kids if you're interested. We go into this, lots of practical hands-on experience, and we'd love to have you there.
Definitely. Thank you so much, Dr. Robertson, for being with us this morning and sharing life-saving information with us. This is the Just Kidz Emergency Medical segment every Wednesday right here on the Now Morning Show. Check them out and, of course, see what they're offering when it comes to how you can save your child's life. We'll be back in a few moments right here on the Now Morning Show.